command here. This bed hasn't been zeroed since September 9th.
Huh?
And that should happen before every new patient. And they've never weighed the patient in the bed.
Yeah.
And even though you might not need the weight for your chart, you've got their weight, the smart bed uses the weight to make that bed exit super accurate. So without it, you might feel like it's super sensitive and going off all the time, or if the last person in the bed weighed 400 pounds and now you've got a 97-pound frail lady, she could be off the bed and it might not realize it. So that weight is super important. If this had the air surface, even more important, because then it's going to inflate for that specific patient's weight.
Okay.
So those were a couple things I'd mentioned in the beginning. Always, before you get a new patient, you're going to go to the scale. You want to zero the bed, new patient. Okay?
So they come up in a bed. So can we do this?
They can do that down. I got a calls about that when you first started down in pre-op and
Yes, ma'am. They're the ones that
yeah.
Okay.
But it's good for everybody to know, because
Yes,
then if you saw that it wasn't done when you had your patient in the bedside chair, perfect time to zero the bed.
Okay.
And then when they get back in, you can weigh them. So then it says let go of the bed. You would want your linens and pillows and everything on there, but just don't lean on the bed. Then you get this screen. Okay. Once that screen goes away, if it's been done for a while, you can still see that it was zeroed.
Okay.
Okay, then I get in the bed if I'm your patient. Can I lay on this top sheet?
Yeah.
Okay. And then you would weigh me. So it's the scale again, and you press weigh. Okay. And it'll beep when you get it. And then you want to save it. You do want to save it.
Oh, you hit save? Okay.
So now you've got my weight. So now, bed exit, you familiar with that? It looks like a bell on the right-hand side. And you've got
three options.
3 modes of sensitivity. The top one is super sensitive. So maybe I just came out of surgery and you want to know when I'm getting with it.
Moves toward it.
Middle one would be the most often.
Yeah.
The bottom one is like an alarm pad on a chair. It's not going to alarm till I'm totally off the bed.
No, we'll do the second one.
Okay.
This is the one we're going to
And
use
now
the
your
most.
light down there for the alarm bell should be green on the floor.
Oh, is that what that is?
That's what you're looking for.
Oh, nice.
So this is called safe view, right? And we say green is good. You're looking for green. One is showing you that the bed's in the low position. It's not right now. So if I'm being naughty.
Please don't get up.
And I tripped the alarm because I went like this.
Please don't get
So
up.
then don't do that. Silence it.
Please don't get up.
That gives me 30 seconds.
I'm going to give this in with
Please
watch
don't
that
get
real
up.
quick.
Okay.
Please don't get up.
Okay. Now it's waiting for the patient. So if PT comes in, they can preemptively silence that. I can go work in the hall for 30 minutes. And when I come back to the bed, because you zeroed it and weighed me, it knows my weight, it's going to rearm the bed exit.
Oh, automatic.
Oh, yeah.
So if you just use bed silence, you don't really turn it off. So then you never have to remember to turn it on. Right?
Okay.
And then your backup is looking at the floor as you walk by a room and seeing green, green, green. That's your backup. I've already done maybe OT came in while you were gone.
Yeah.
And then it's on. Or if they turned it all the way off. But ideally, if we train people to use the silence, then we don't have to remember to turn it back on. So if you want to preemptively hit that yellow button again, the silence, and I'll get out. Okay. And that's what happens. It changes to waiting for patient. So
I didn't know.
I'd be gone for 2 hours. So it's a really nice safety feature.
Yeah. Well, that's easier.
If you're PT and you're working with the patient dangling legs, stands and sits, you probably have to turn it off, you know.
Oh, okay.
But if you're going to help someone to the toilet, or you just preemptively, you're going to go do PT, they can push that yellow button and they don't ever turn it off. So that makes it nice.
I'm going to go see the flat. I'll be right back.
Now I will turn it off. So on the right is pretty much your command line. So you've seen where the alarms are. You have a head of bed alarm there too if you want to limit 30 degrees. Your head of bed readout comes right here. And you probably don't see lots of feeding tubes and stuff here, but if you had one or you had a respiratory patient, you just kind of want to keep them more upright.
Our hips can't go over 30, is that right?
If I get over 30, then I've got this quickie one right here. That sets the head of bed alarm. So now if the patient tries to lower their head of bed, it'll go to 30.
This function is unavailable.
Okay. And I don't know if you remember, but you can change that language that says that, or please don't get up. Do you remember that? Okay, so that is in the settings. And bed features, voice alerts, patient language. If I change it to Spanish, accept. Okay, now if she tries to lower.
Esta función no está disponible.
Okay, so you can make the bed, but my messages as the caregiver are still
Break
English.
not set.
Okay, so it'll remind you if you don't set the brake. It'll remind you if you don't plug in the call light, the alarm, the bed alarm. And then your white cord is what powers the auxiliary outlet, patient left.
Over there. Okay.
The gray cord is the power for the bed.
Okay.
So
How do I take this off? Like, how do I discontinue the alarm setting on the 30 degrees?
okay, on that home screen again, you just toggle it, push it again.
Oh, it takes
Okay.
it off.
The other way that you could do that,
Is if it's locked here, you have
Right.
to push this and this at the same time.
right, so that's another way of doing it. This is real quick and easy, but obviously if you need to lock out knees or feet, you would do that here, the padlock and the feature, and then it'll show you that it's locked.
And we do locked out knees.
And toggle it off the same way, okay? Are you comfortable and familiar with the IntelliDrive, the transport drive?
Oh, yeah.
Engaging
You have to
that?
give it a little second to warm up, and then it goes.
Yeah, when you have the bed unplugged, and then you put this into steer, you have to listen real close because of the noise, but you're listening for that wheel to drop. You want to let it drop all the way. If you start trying to do it beforehand, you can pull the little wheel, the little plastic off the wheel, and then it'll have to be reset. So once that's done, then it's just these little buttons underneath. You just engage one, you don't even need both, and push forward on the handle. Your bed's just gonna go.
Oh, good. Well, then I can move
Okay, and it turns really easy on a dime. Super easy one-handed.
Nice.
So when you do have patients of size, because this will take a patient weight up to 500 pounds, this is a real back saver for you guys.
I have a quick question. The lights that come on down here,
Yeah.
I had a question about it the other day. I was so confused.
Okay, let me plug this back in. And then we can look at them. Of course, you can't see them until I'm sitting in.
So that's our bed alarm.
That means no bed alarm.
So blue means that in the middle,
It's
that's
not.
the bed exit, and it's not set.
It would be green if it was.
Now you'll see what it means bed in the lowest position. Because ideally, right, we want to leave the room with the
Yes.
bed low. And it'll beep when it gets there. There you go.
Oh.
So sometimes you think it's all the way down, but listen for that beep, and then this will confirm it too. This means your
Side
side rail,
rails over there.
side rail protocol is not met. We don't have two uppers up.
Oh, that's pretty.
Okay,
Okay.
no.
That's so pretty, right?
That's nice. Yeah, so that's kind of our mantra with these new beds. Green is good. So this is your backup in the hallway to see, did anyone come in my room and mess with the bed exit? I mean, we're always trying to avoid those falls. So between silencing it instead of turning it off, and then this backup, we see a huge reduction in falls. So big benefit.
I have a question. How do you make, I know we can extend this so many inches. How do we do that?
Right there.
You've got a whole foot to play with, and it's these feet right
Ah.
here.
And you have to hold.
It's like magic. You can stop it at any point to customize it to your patient.
Cause I've had a couple of big 6-footers lately.
Yeah.
Oh,
This can take a patient like up to 6'7". This is so great. The mattress is attached like it's supposed to be. If you ever see this coming all the way out and the mattress is staying back there,
It's not attached yet. With
you
those
know these little
ball
balls?
thingies, yes.
Yep. So there's 2 down here and 2 up there.
Okay, so there's a reason those are there.
Yeah, for sure. Because they need to unhook them to do their housekeeping.
Yes, ma'am.
But then sometimes they don't get attached all the way. So it's a good double check.
That's nice.